Well, good morning again, and this is Dr. Bill Wyatt with the American Orthodontic Society. And I thought this morning I want to show you some things or just talk to you about some things that happened when I first started. I worked in my regular office there in Hurst, Texas for about 6 years. But my wife and I wanted to go to Nigeria as missionaries, and so we went to Nigeria, and they had an office in Ibadan, Nigeria, which is one of the large cities, one of the largest black cities, really, I think it's said in the world. And so we worked there for about a year and a half, and I went from that position. The people we had, the mission that I worked with had about 3 hospitals out in different areas in Nigeria, maybe it was 4. And then we had a lot of schools, church schools and things in different areas of Africa. And one of the schools, the teacher was a friend of mine, and he said, I want you to come to this school and go over the kids and see what problems they have and see what you can do is everything in relating to orthodontics and also to filling their teeth and their dental work and everything. So I went to this school, but prior to going to that school, I had gone hunting with a friend of mine back out in the bush, way off, and I came up to one village that I could not, I must tell you, I just took this one picture of this young man who was not able to nurse, but just say maybe a year, and his mother had another child, and then she nursed the baby, and she didn't nurse the older boy, which might be a year old or year and a half, something like that. And they call this problem that develops kwashiorkor. Now, don't ask me how to spell it, anything, but anyway, the children that didn't get nursed, their stomachs would get as big as a watermelon. And I had heard people talking about it, and we were out in this village, and I came upon this young this village. We were sitting down there resting, and this young man walked past. I want to show his picture here in a minute, if I can get it up there. This young man walked past. I mean, they had no clothes on at all. Anyway, we covered up. And as he approached me, I tried to take a picture, and he didn't want me to take a picture of him. And so he went on past. I went ahead and took the picture from the backside of this young man, and his stomach is as big as a watermelon up there. I just felt so sorry for this kid. Now, what happens if a mother has one baby, then the father leaves that village and goes and stays in another village till the child gets old enough, and then they may have another child 2.5 or 3 years later, and the first one then will live on. So this is something that I learned, that this was going on in Africa, and that really shook me up, that people without protein, they didn't have enough protein to give this child, and he just didn't have any, and so they call this kwashiorkor, and this child will live till maybe it's 10 or 12 or something like that, and he dies. And it's just, that happens. And I'm sorry to say that. And I just wanted to show this is what was going on in many of the places. Now I'm going to just lecture from that point on, and I'll just go back and talk on the video here. The things that I learned, I went to this school, which was fairly large. I mean, they had about probably 150 or 200 students there. There's been no dentist had ever been, they've never even seen a dentist in a thing. And I carried the young men that worked in the dental office there. We had about 10 or so young men that worked, and they went with me and they cleaned all the students' teeth and everything. And while I set up a fancy drill and everything, air turbine, but all I had to have was a generator to run it. And so I worked in one room, and I filled all the teeth in that whole school. And you won't believe it, but I filled only 12 teeth out of this whole school had cavities. And the only explanation I could come to was that they never ate anything sweet that I knew of. So they think that they ate, and they brushed their teeth with a stick. And they had a tree that would kind of, you chewed on the end of a little stick and it would get like a brush. And then you could take that and go around and scrub your teeth with it. And that was a chew stick. And that's the way they brushed their teeth. Well, I went through this whole school, and they had only 12 cavities in this whole school, and I could not believe it. I mean, and the boys out on there at the school were cleaning all their teeth and all this. I took out one supernumerary tooth on one person, and the rest of them's teeth was straight. And you'll just have to believe me, but that's a fact. That they were bimaxillary protrusive, they were full-faced, and they had full African-sized teeth in there, and it all fit and it worked together. And it had been that way for thousands of years, I guess, hundreds of years. They didn't spread out and mix with people much. And that's what I contributed, the fact that they had no orthodontic problem. So this was African orthodontics compared with American orthodontics. In America, we had just a ton of kids. You go through them, and at least half of them need orthodontics or more than that. And this is because we mix people together. And I learned this, that if a person with a large facial structure and everything, large bone structure, marries somebody with a thin bone structure and everything else, and the child may get this small structure with a big tooth. Now, you'll have to remember this, that the ectodermal layer of a child forming, the skin and the teeth have the same ectodermal source right there. In other words, if they get an African skin, they would get an African tooth. And so I'm going to have to switch from this school now back into town. And I had a family there of American blacks. They call them American blacks. They weren't much darker than I was, with a good tan. And the mother and father were both highly educated. She was the librarian at the university there in Ibadan, and her husband had a doctor's degree in agronomy and was teaching farming lessons and stuff to African people out there. And this family were very light complected, and they had two daughters. The older daughter was just as light complected as the mother and the father. But the younger daughter had a neat personality, but she was darker than either one of them, or any of them in there. And she came in for me to work on her teeth. Now, the younger daughter, and don't think I'm biased or racist or some idiotic thing. These were people that I knew and worked with, and we even saw them socially and stuff like that. I had to come in and try to straighten the young girl's teeth out, and her teeth were huge, and there was no way I could get the teeth in, so I had to take her bicuspids out, and we took her wisdom teeth out, and we put the rest of the teeth in the mouth, and the face looked great. Face looked fine. So she had African skin, and she had an African tooth inside a Caucasian or a small bone structure, and they just don't fit. And so you have to reduce this down. Now, having the two colors showed me that completely. Now in the States, I see people that had large structured teeth and married to somebody that has small teeth over here, a small place, and they get the tooth from the skin, and they will have teeth that do not fit. And so there was arguing this question of should we take out teeth or not take out teeth. It is a ridiculous thing. And there are cases that really need to have teeth taken out so that you can make the tooth that's there fit the bone structure that is there. And you have to remove some teeth on some people like that. That solves that question in my mind completely. So I never had worried about that before. Now the fact that these children in this school had no cavities and they had no orthodontic problem is that was taken care of by nature. Now nobody's teeth come in their mouth in exactly the right position they should come in. So the body, if the person is functioning correctly, you can reduce or enlarge whatever area the teeth needs and let the thing develop. And this way we use nature to straighten the teeth out. Teeth come in the mouth, and if you are swallowing correctly, you bite down on your teeth, and your tongue pushes out on the teeth, and there's a pressure from the inside, and there's a pressure from the outside, and the teeth go to the place where the pressure is the same. And I don't care whose diagnosis you use, they can't tell you exactly where those teeth are going to go because they don't know all this pressure. But we'll show you some cases where we just let nature straighten the teeth out. But then I wanted you to remember that in Africa, if the person didn't have the right diet, they suffered with death. So we can have children that don't nurse properly. Now, I want to talk about the nursing a little more. So the African child nurses for about 2.5 to 3 years. Now, you cannot nurse and breathe through your mouth at the same time. If you are a mouth breather, your tongue has to be in the bottom arch when you're breathing. You can't suck air under the tongue like that. So your tongue stays in the bottom arch, and you're breathing a lot out. If you're a real chronic mouth breather, you have your mouth open most of the time, and frequently you do not swallow properly by biting together. That's an adult swallow. A child swallows, an infantile swallow, they're supposed to come out of that after about 2 or 3 years, something like that, where they're biting together to swallow. And if you don't do that, in other words, you swallow and the tongue comes like that, and you don't bite your teeth together, then your teeth will erupt toward one another more than they should. And your facial structure will get broader here. And the tongue stays in the lower arch, and the lower arch will get wider than it should. The lower arch should fit underneath the upper arch. Now as it gets wider and wider, you get to where you eat cusp to cusp, and a lot of people shift and move over. So you look at adults, and some of them have the mouth one way or the other. They usually were mouth breathers, so we have so much allergies here in this country. And they can have other things, enlarged turbinates in here. You can have adenoids and tonsils and different things that people have airway problems. Get somebody functioning correctly, and then you can get their teeth to do some very wonderful things and let nature take care of it. And I'll show some of that later on. But anyway, I looked all my life for somebody in the States that had no dental problems. I mean, no problems, their teeth were straight. And I have not found anybody like this class there. And old stupid me, I didn't even look at my wife. And my wife had just perfect teeth, but she never even saw an orthodontist. She grew up out in the Comanche National Forest. And my wife told me later on, says, I nursed till I was 2.5 years old, until I was embarrassed with doing that. And this long nursing forces somebody, their airway to develop. And if people develop this properly, I look over my wife sleeping at night with her mouth shut, and I'm over there, I'm a mouth breather, and I'm having trouble with it. And I think to myself, if people knew this, now there's no way that American people can have children and let them nurse for 2 or 2.5 years like that. But some way, Mother, we can try to reproduce the problem that they have. A lot of these African kids, I watched them. They rode on their mother's back, and they would nurse, just slide around the side. And a lot of times they'd be nursing, getting very little, if no milk, but they were nursing. And that made them develop adequate airway. And so few of these kids in that school, they had no breathing problems if you went through and looked at them. So I hope you'll pick up some of these things that I picked up in Nigeria, and the things that I saw there taught me a lot of lessons about what causes orthodontic problems that we have here in the United States and over the world over. We're the most mixed up people you ever saw in your life. I mean, from everywhere. And so I want to hang up and say goodbye for the day, but this is a fact that children need to nurse more, but we can't do that. I mean, ladies here in the States can't run around. So there may be some way or another that we can reproduce a natural thing here with a child with some of the things they develop here. So thank you for watching, and I'm going to hang up and say goodbye for the time being. And I hope you will join our group and subscribe to it. And I'm going to try to cover from their own working into orthodontics. And I'll say goodbye now.